Welcome to the Essence of Health Tea Time Podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board-certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. In today's episode, I'll be spilling the tea on medication-assisted weight loss. What is it? Does it work? Is it a magic pill? Before we dive into this episode, if you haven't already, I encourage you to take a listen to episode 9 of the Essence of Health Tea Time podcast, where I discuss the complexities of obesity. Listening to that episode first will give a solid foundation for the information discussed in this episode. Now, let me remind you of some of the stats related to the weight loss industry in America. In the United States, the weight loss market is a billion-dollar industry. It is estimated that 45 million Americans start some form of diet plan each year, and that in 2021, Americans spent over $70 billion on weight loss products. However, it is still reported that nearly 2/3 of Americans fall into an overweight or obese body mass index category. Obesity is a chronic, manageable health condition that is caused by a variety of contributing factors. It can be challenging to treat and manage because it is far more complex than diet and willpower alone. I was recently quoted in an article for which I'll place the link in the show notes. The topic of the article was regarding the shame, stigma, and weight bias that exist in the healthcare setting and how care should be moving towards a more weight-inclusive model of care and not defining a patient by the number on the scale. My contribution to this article was the fact that it's important for those in healthcare to approach patients from a perspective of health, prevention, and improvement of chronic disease, not placing the primary focus on the number on the scale. The majority of individuals don't choose to be overweight. Weight gain and the science of obesity have taught us that this chronic condition is far more complex than a condition of lack of willpower, so we should treat this condition as such. And with that in mind, let's explore a method of treatment for chronic obesity: medication-assisted weight loss. Now, to all of those who may be listening and thinking, well, isn't this just giving people a crutch and no incentive to make changes in their diet and exercise patterns? Once again, I encourage you to take a listen to episode 9 of the Essence of Health Tea Time podcast, where I discuss the science and complexities of obesity. Over the past several years, we have learned that some of the causes of obesity include genetics, psychological factors, socioeconomic factors, environmental factors, sleep disruption, appetite dysregulation, chronic stress, hormonal imbalance, and prescription medications. We can't always modify these factors, and we do know that there are risks associated with having the condition of obesity. So this is where the treatment of medication-assisted weight loss can play an important part in obesity management. There are several weight loss medications that have already been approved by the Food and Drug Administration, or FDA. Several more are in the testing phase. The Obesity Medical Association, or OMA, recommends 4 non-surgical options for the management of chronic obesity, including appropriate nutritional modifications, physical activity, healthful behavior changes like stress management and quality sleep, and the addition of anti-obesity medication treatment. Studies have shown that even a 5 to 10% loss of one's current body weight can have an important impact on reducing one's risk of complications from chronic health conditions like high blood pressure, diabetes, heart disease, fatty liver disease, osteoarthritis, and sleep apnea. The goal of medication-assisted weight loss treatment is to serve as an adjunct to a healthy diet, active movement, and healthful behavior changes. Treat a condition called adiposopathy or sick fat disease and its potential health consequences, treat a condition called fat mass disease, slow the phenomenon of weight regain that often recurs in chronic obesity, serve as an adjunct to bariatric surgery in further improving weight loss efforts, and to generally improve the overall health and quality of life of patients with obesity or pre-obesity. So, as you can see, in the field of obesity medicine, we aren't just providing the proverbial magic pills. We are actually treating a health condition, just as you would any other health condition. So, let's dive into the currently available medications that are FDA approved. A few disclaimers here. One, I will be discussing medications that are available in America. I am aware that some of my audience are not located in America and sending you a special hello. So this information may be different for you. Two, I will be discussing information that is available as of January 2023. The obesity medication field is ever evolving, and I am aware of some other options that are on the horizon, but we will not be discussing anything that isn't currently at this moment in time FDA approved for the treatment of obesity. Three, as always, when you're listening to the Essence of Health Tea Time podcast, the information shared here does not constitute medical advice, and you should always be evaluated by your personal physician before taking any medications or adding any other therapies to your health regimen. As anything, whether it be a prescription medication, a vitamin supplement, or a yoga pose, can come with some potential health risks depending on your personal health situation. So see your doctor. Now, get this tea about the available medication-assisted weight loss options. Medications like phentermine, also known as Adipex, and similar medications in its class, including phendimetrazine and others, are some of the oldest medications available and have been around since the 1950s. Over the years, these medications have also been combined with other substances to produce medications like fen-phen, which was a combination of fenfluramine and phentermine and was very popular in the 1990s. However, fen-phen was removed from the market by the FDA in 1997 after it was linked to causing heart problems in the individuals who took this combination pill. While phentermine is still on the market and it does come with some cardiovascular risks, further studies found that the combination of fenfluramine and phentermine together, as in fen-phen, was dangerous, causing excessively high levels of the nervous system hormone serotonin, which led to severe heart damage. This is definitely something to keep in mind if you are seeking medication-assisted weight loss therapy. Not all individuals who provide healthcare are trained as experts in obesity medicine. I am particularly fellowship trained in this field, and with this level of expertise comes an awareness of the potential risks and outcomes associated with providing treatment with these particular medications. I encourage you to visit the American Board of Obesity Medicine's ABOM website to find an obesity medicine board certified physician in your area who can provide you with safe treatment for the condition of obesity. If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting. You know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to eohcoaching.com to learn more. The essence of health is in you. I'll place the ABOM Find a Physician link in the show notes. Now, let's go back to phentermine. As I previously stated, phentermine, not fen-phen, is FDA approved as of 1959 and available for treatment of obesity. It works by suppressing your appetite and making you feel less hungry. It has been shown to aid in an average of 3 to 8% of weight loss. Some individuals report that it also gives them more energy and alertness, as it does have a similar makeup to attention deficit hyperactivity disorder or ADHD stimulant medications. Phentermine is approved for use for up to 12 weeks or 3 months, but there have been some studies showing that it is safe and works well also for longer term use without increasing risk of adverse events beyond those risks that normally would come with this particular medication. Next, let's chat about Orlistat, also known as Xenical or Ally if you purchase it over the counter without a prescription. Orlistat was FDA approved in 1999 for the treatment of obesity. It works by decreasing the amount of dietary fat that is absorbed into your body and allows you to eliminate that fat as waste. It has been shown to aid in an average of 5% of weight loss. It can cause some gastrointestinal side effects related to the amount of fat consumed. So, with Orlistat, it's definitely important to make sure you're following a more low fat, plant based way of eating. Orlistat is the stronger version of the over the counter medication Ally, but they work exactly the same. Some of the newer medications on the market have come about within the past 10 or so years. So, let's discuss those. Kismia is a combination medication that combines phentermine, the appetite suppression medication we just previously discussed, with topiramate, another slightly older medication that is FDA approved for a number of health conditions. The combination medication Kismia was FDA approved in 2012. It works by making you feel less hungry and by cutting down on food cravings, giving you less desire to eat unhealthy foods. It has been shown to aid in an average of 10% of weight loss. As this is a combination medication, one would need to consider the potential risk of the two medications individually that are in this particular medication when considering if this may be right for you. There were two medications approved for weight loss in 2014, Contrave and Saxenda. Contrave, like Kismia, is a combination medication. However, Contrave combines the two medications of bupropion and naltrexone. Both of these medications, when used individually, are FDA approved for multiple other health conditions. However, as a combination, this medication is approved for the treatment of obesity. Contrave works by making you feel less hungry and by cutting down on food cravings, giving you less desire to eat unhealthy foods. This is similar to the way that Kismia works. However, the medications combined in Contrave are totally different from the class of medications combined in Kismia, giving you a different set of risks and benefits. Contrave has been shown to aid in an average of 5% of weight loss. Saxenda or liraglutide, our other medication that was approved in 2014, is an injectable medication approved for the treatment of obesity. Saxenda works similarly to a newer drug on the market that we'll discuss shortly called Wegovy. Saxenda works by making you feel fuller longer by slowing down the rate at which food is metabolized through your body. It also works on decreasing those signals from your brain that typically signal that you are hungry, thereby promoting less food intake and weight loss. Saxenda is a daily injection and has been shown to aid in an average weight loss of 5 to 10% of one's body weight. Now, let's discuss our newcomer on the market, Wegovy. Wegovy or semaglutide is an injectable similar to Saxenda. However, instead of a daily injection, Wegovy is injected once a week. Wegovy was FDA approved in 2021 for chronic weight management in adults with obesity. One note here, you may also hear a lot about the drug Ozempic being utilized for weight loss. Wegovy and Ozempic contain the exact same drug, semaglutide. However, Ozempic is only FDA approved for the treatment of diabetes mellitus type 2, and Wegovy is only FDA approved for chronic obesity. It's semantics, but a very important note. Semaglutide is in the same drug class as liraglutide, Saxenda, that we just discussed. So semaglutide also works to promote weight loss by making you feel fuller longer, by slowing down the rate at which food is metabolized through your body, and by decreasing those signals from your brain that typically signal that you are hungry, thereby promoting less food intake. But get this tea. Wegovy has been shown to be highly effective at promoting weight loss, with studies showing an average weight loss of 15% of one's body weight. So this particular medication is showing a lot of promise for those with obesity. Developing research is emerging regarding the length of time one may need to take these particular medications. The medications we discussed are approved for longer-term use because we know that obesity is a chronic, lifelong health condition for many. There is also evidence of a phenomenon called weight set point and some science behind the challenge of weight regain, which we'll discuss in a future episode of the Essence of Health Tea Time podcast. And these medications can be helpful in this arena of treating obesity. Remember, all of these medications come with potential risk of harm as well as benefits discussed here. You will definitely want to review these risks with your personal physician to determine if any of the medications may be right for you. The other takeaway point is that, as we discussed at the beginning of this episode, medication therapy is an adjunctive or additional treatment for obesity, meaning that one should still be mindful to consume a healthy diet, get routine physical activity, and practice healthy lifestyle behaviors, including maintaining a healthy mental state, getting quality sleep, and managing stress appropriately for overall sustainable health and wellness. Now, let's move into our Ask the Expert segment of the podcast. Today's Ask the Expert question is, what are the best natural herbs for weight loss? This question is one that I commonly get from clients at Essence of Health. So let me get you the skinny tea on herbal supplements used for weight loss. Fiber is one often overlooked supplement that can aid in weight loss. There are several over-the-counter fiber supplements that you can take. Fiber works by making you feel more full and helping your body to metabolize carbohydrates better without harmful insulin spikes, which promote weight gain. When it comes to fiber, the best fiber can be obtained naturally by increasing your intake of dark leafy greens, beans, and cruciferous vegetables like broccoli. But adding fiber in the form of a supplement can also be helpful. Caffeine is another supplement that has been used for many years to aid in weight loss. There have been many over-the-counter weight loss supplements marketed over the years, and the majority of them contain some form of caffeine, whether it be from coffee extracts or green tea extract. Caffeine works by reducing your appetite, increasing focus and alertness, and by giving you an energy boost. For those with heart problems and blood pressure problems, be mindful that caffeine is a form of stimulant and can worsen these health conditions. Caffeine can also increase nervousness, anxiety, and cause tremors, so definitely think of it as you would any other medication and weigh the risks and benefits. Another more popular supplement touted for weight loss is apple cider vinegar. Yes, the same vinegar used in salad dressings and sauces. I will say that the weight loss claim for apple cider vinegar is controversial, and it won't likely help you to lose a substantial amount of weight. But it has been shown to slow down the rate at which your body metabolizes food, causing you to feel fuller for longer, and can help your gut to function better, which in turn may result in some mild weight loss. There were also some small studies that resulted in individuals reducing their triglyceride levels and burning fat by consuming apple cider vinegar. When it comes to herbal supplements, one thing that I do like for people to keep in mind is that vitamins and supplements are not regulated by the Food and Drug Administration, so there is no regulation regarding the claims that can be made for the supplement, and no regulation regarding what or how much of the ingredients listed are actually in the supplement. So keep that in mind when you're purchasing supplements and always do some additional research into the source of your supplements. Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@EOHWC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.eohcoaching.com. The essence of health is in you.